and experts in the agricultural value chain have called for more investment in the sector to ensure food security and drive sustainable development in the polity. They made the call at the first annual socio-economic summit of the Jericho Businessmen Club with the theme Driving Agricultural Transformation in Oyo State through Value Chain Integration for Sustainable Development. There is more in this report. It's a gathering of stakeholders in the agriculture value chain to generate strategies and actionable ideas for driving agricultural transformation through value chain integration, with a view to making Oyo State the leading agro-industrial hub in Nigeria.
The idea is for us to serve as an advocacy for policy formulation, generation of ideas, and harvest of policies that will help government in directing the policy and development of the country, of the state, and of Ibadan.
We need to intensify our effort in agriculture and not only producing those agricultural products, but also to use technology to improve.
We must have plans and strategy to take this technology down to the grassroots so that the smallholder farmers can increase their yield and they can be able to make more money.
Critical to the success of agribusiness is energy. The Minister of Power says his team is working to address the challenges hindering uninterrupted supply.
We are trying to reduce the meter gap to ensure that every household has a meter, every business has a meter. We're also trying to work on the legislation that will ensure that power theft becomes a thing of the past. The discos must invest in improving infrastructures of the distribution.
To make the most of the immense potential in the agriculture sector, experts say there must be value addition, a move from being an agrarian society to industrialization using technology.
There's a lot of value in our agricultural products. Farmers are benefiting, every workers are benefiting, and the company is benefiting. Then definitely the nation will benefit when you move to the level of exporting some of those products.
Nigeria has to move from being an agrarian society. Nigeria has to invest massively in agribusiness. Nigeria has to move into industry, manufacturing to add value to its products. Nigeria should not be an exporter of raw materials.
These experts are optimistic that agriculture could be a game changer in boosting Nigeria's earnings and improving the quality of life of Nigerians. And in Borno State, the Nigerian Association of Psychiatrists has carried out a medical outreach to survivors of insurgency and other indigent residents of Dala Community. This gesture is aimed at bringing succour to those affected by the conflict. TVC's Jesse Tafida has details.
60-year-old Halima Baba is here to benefit from this medical outreach. She joins the over 500 people from Dala Community to be diagnosed free of charge. Although government and humanitarian organizations provide healthcare support, the situation remains overwhelming.
Here we are to give back to the society, to render services along the length and breadth of Maiduguri to those who are indigent, who are not able to access care ordinarily, and then to offer them all the needed support.
This gesture by Association of Psychiatrists in Nigeria as part of activities marking its 54th annual general and scientific meeting. Over 50 medical professionals are attending to all kinds of ailments.
The essence of providing mental health care or general medical services is getting to the roots and getting to the target population that are involved. Integrating health into the primary health care is an integral component, and that's what we are trying to demonstrate. And we are trying to offer free services to those that cannot afford and to indigent people in the community.
People have suffered psychotrauma. There are a lot of conditions that affect the mental health of people as a result of psychotrauma. So these are basically most prevalent conditions that we tend to see in the hospital.
Free drugs were available for all patients, and beneficiaries appreciate the gesture. He says, "I'm overwhelmed by this medical outreach. I've been suffering for long at home without medical care due to lack of funds. But today, I've received a free medical care." The healthcare needs of the survivors of the 13-year conflict in Borno has continued to be of concern to many. And with such program available, it will no doubt put a smile on their faces. Over 500 residents of this community are expected to benefit from this medical outreach, which is believed will go a long way in improving their health conditions. Jessie Tafida, TVC News, Maiduguri.